Rahul Kodak. I am a public health nurse, and I am part of the Infection Prevention and Control team.
Cool.
It is part of my job to conduct investigation of communicable diseases such as hepatitis A, hepatitis B, and C. We're going to be talking about hepatitis A, and these are some topics that we will be covering. And to start off, we're going to start with an introduction. Viral hepatitis are a group of several distinct liver infections with similar symptoms, but different immunological, clinical, and pathological characteristics. Hepatitis means inflammation of liver. It can be acute. An example would be hepatitis A. It can be chronic. An example of that would be hepatitis C. Some classifications by mode of transmission include enteric hepatitis, which would be in the fecal or oral route, and some examples include hepatitis A and E. It would be blood-borne hepatitis. Examples would include hepatitis B, C, and D. Hepatitis A is referred to as one of the oldest diseases known to humankind by the World Health Organization. It is also known as a dirty hands disease. It was clearly recognized as a distinct hepatitis during the Second World War, and it was discovered by Stephen M. Feinstein in 1973, a virologist. Hepatitis A is a viral liver infection caused by the hepatitis A virus, which is a positive-stranded RNA spherical and non-enveloped virus. It is a very small virus. It is 27 nanometers. The virus is stable in environments up to a pH of 3. Laboratory experiments show that the Hep A virus can survive 60 days in fecal suspension and 1 month in dry feces. Because it is a non-enveloped virus, it is hard to be killed. High-level disinfection is required, such as 7% hydrogen peroxide or 2000 ppm bleach and water solution. The infectious dose is very small, only need to ingest 10 viruses to become sick. Hepatitis A is an acute self-limiting liver infection. Symptoms may range from mild flu-like illness to 1 to 2 weeks of mild self-limited disease with jaundice and to fulminant hepatitis. Typically, acute clinical illness is characterized by an abrupt onset fever, tiredness, loss of appetite, anorexia, vomiting, nausea, and abdominal pain, followed by jaundice. Jaundice is a yellowing of the eye, palms, and skin, and diarrhea is rare. Dark urine, light-colored stools, and an enlarged liver may be seen. Symptoms vary with age. Infection is usually asymptomatic or inapparent in children, and jaundice develops in less than 10% of children under the age of 6. Adults are typically symptomatic with more severe diseases. The actual number of HA cases is estimated to be 7 times higher than reported cases. Incubation period will be 15 to 50 days, on average 30 days. Period of incubation is the time between when you ingest the disease-causing agent to the time when you develop the symptoms. After this, you will get lifetime immunity. Period of communicability is the time when you can transmit the disease to others. This means you're infectious. Cases are typically infectious 2 weeks before the onset of symptoms and remain infectious until a week after the onset of jaundice or 2 weeks after the onset of a disease if jaundice isn't present. Some human reservoirs include humans and rarely chimpanzees. Hepatitis A is transmitted through the fecal or oral route. The virus is found in feces. Person-to-person transmission is the most common mode for all enteric viruses. It can be indirect through the ingestion of contaminated water or foods, and it could also be sexual activities that include direct or indirect oral and anal contact. Hepatitis A occurs worldwide, sporadic and epidemic cases. This map from the World Health Organization shown in orange the epidemic areas. Canada is not one of them, only sporadic cases. In epidemic areas, the adults are usually immune. Here are some countries at higher risk of hepatitis A. These countries include India, Pakistan, the Middle East, and Mexico. In order to diagnose, doctors collect blood samples that are sent to the lab for analysis. The lab will detect the presence of IgM and IgG antibodies. Presence of IgM and hepatitis A antibodies confirms recent infection. So in order to diagnose, doctors collect blood samples that are sent to the lab for analysis. The lab will detect the presence of IgM and IgG antibodies. Presence of IgM anti-hepatitis A antibodies confirm recent infection. The presence of IgG antibodies in the blood means that the person is immune due to previous vaccination or illness. The virus can also be detected in a stool sample. This right here is a requisition form sent to the lab along with the blood sample. Here are some prognoses on the disease. There is usually complete recovery without complications. Lifelong immunity is developed. it has been reported that between 3 and 20% of cases may experience relapsing disease. Fulminant hepatitis and death are rare. Chronic infection is not known, of course. So what is the treatment for hepatitis A? Well, since a viral infection, there is no actual antibiotic treatment. It is up to the immune system to fight off the disease. Resting, immune boosters, medication, liquids, and electrolytes to prevent dehydrations are highly recommended. Medications for fever may be prescribed. Vaccination as a prevention method. Some natural remedies include probiotics, as they restore bowel flora and improve liver enzymes. Healthy eating diet, which excludes fried foods, and vitamin C as an immune system booster. It is important to know that the Food and Drug Act prohibits advertising of any food, drugs, and device to treat specific diseases included in Schedule A of the Act. The list includes hepatitis as well. So crude rates versus fatality rates. Crude rate is the frequency of a disease in a defined population over a specific period of time. In order to calculate this, we take the total number of cases and divide it by the number of population. Peel crude incidence rate per 100,000 in 2016 for hepatitis A was 1.4. Fatality rates is the proportion of death within a designated population of cases. In order to calculate this, we take the total number of deaths for a specific disease and divide it by total number of cases diagnosed. World Health Organization reports a very low fatality rate for hepatitis A of 0.1% to 0.3%. This chart shows the number of hepatitis cases in Peel versus Ontario. For example, in 2016 there were 23 cases in Peel and 126 in Ontario. So all positive cases of hepatitis A are reported to the health units. Public health nurses conduct the investigations. Each investigation has two major components: management of the case and management of contacts. Information such as travel history, detailed food history, high-risk behavior such as intravenous, drug use, onset of symptoms, recovery date, contact with other symptomatic people, and occupations are collected. The info is very important as attendees or employees of child care center, resident, or staff in institutions such as hospital or food handler must be excluded from work. Two more things I would like to cover are the definition of onset of symptoms and recovery date. The onset of symptoms is the date when symptoms start. Recovery date is the date when symptoms stop. So contacts of cases include household contacts, non-household contacts, sexual partners or drug sharing partners, contacts who are food handlers or daycare or hospital employees. Once contacts were identified and considered at risk of developing the disease, are entitled to receive from health unit 1 dose of hepatitis A vaccine for free. This is called post-exposure prophylaxis, and it can be hepatitis A vaccine and/or immune globulin. Children under 12 months of age receive only immune globulin. Hepatitis A vaccine can also be given as a pre-exposure prophylaxis before the exposure to a hepatitis A virus as a prevention method. Here are two examples of vaccine: adult dose, which is called Avaxim, and a pediatric dose, which is called Vacta. Public health nurses deliver the vaccine to the doctor's office. The vaccine needs to be maintained at all times at a temperature between 2 degrees and 8 degrees Celsius. For full-time immunity, a second dose needs to be administered 6 months after the initial dose. That can be completed through the family physicians. In Canada, grade 7 students are vaccinated against hepatitis B, not A. A dual vaccine for hepatitis A and B, Twinrix, is also available on the market. So let's talk about prevention and education. Hand hygiene is the single best method to prevent the spread of diseases. Other recommendations are to avoid preparing food while sick, avoid drinking contaminated water, seek medical advice before you travel to endemic areas, and disinfect areas contaminated by feces. Vaccination, as mentioned before, is an important prevention method. On the slide, you can see a fact sheet about hepatitis A that nurses provide to the public. And here are some resources that I used in the creation of this presentation, and now it's time for questions.